also think that it calms the muscles, that it causes them to elongate and relax, and it does not. It does the opposite. Now, that's not saying it's bad. It's just saying it's a tool, and we're using it in the wrong way. If I wanted to relax a muscle, I would use the opposite.
You have to come in.
I would use the opposing muscle in order to get neurologically to get it to shut down, to inhibit it. And so when we stretch a muscle, it causes a muscle stretch reflex that's there to protect the muscle, but also to protect the joint from injury. So it reflexes, against what you're doing. And so there's a lack of understanding that muscles really don't work individually. They don't. They work in what's called muscle synergies. And those muscle synergies are different from person to person because you created those muscle synergies throughout your life, and the things that you asked your muscles to do, or your joints and everything. And so you created these synergies to become as effective as possible. And some of those synergies are very ineffective and they have to be retrained. But it's not going to be, like, let's say I have a weak right glute, right? It's really a right glute it's not a part of the synergy. And if we can re-engage it and neurologically get it to become a part of the pattern, then it will do its job. And all of a sudden it will become strong, all of a sudden, out of the blue. And so when we're messing with stuff like that, we're messing with significant imbalances from a muscle point of view, but also from a neurological point of view. And so when we mess with it, we're actually messing with joints that are in some ways unprotected and can easily be heavily affected. And so when you're stretching a muscle, you need to realize I actually need to deal with a function rather than an individual muscle. And I also have to reintegrate that back into the function that it does in the lower body. One of the major functions is squat. What's another one? Walking. And so I'm going to use the squat to reorganize that system rather than just working with that individual muscle.
Okay.
And so when I go to stretch, and that protective mechanism is not in play, is not engaged, I could potentially significantly overstretch it. And when I say overstretch, there are two overstretch problems. One is, we call it a strain. That means the muscle got injured, or the components of the muscle got injured, and then there's the sprain. Both are possible because, like I said, it's a less than protected or unprotected joint because those muscles aren't active to do their job and to do the reflex that would protect the individual.
Okay.
And when I'm looking at, like, let's say I'm looking at a hip joint, and the hip joint has pain going through the range of motion, I'm looking at it saying, how did that happen? If it never happened before, right, and then all of a sudden it's taking place, yeah, we either have a strain or a sprain, and as a result. And so if it only happens with contraction of the muscle, it's a strain. If it happens with a passive stretch, then we know we sprained it. And I much rather and as an athlete, I would much rather have a strain than a sprain, because the protective parts of the joint that are ligaments don't have much blood flow. Those take a long time. If you stretch them too far, then that becomes permanent. It's like overstretching a spring or a rubber band.
Right, and I was not oxygen. I said a point. I haven't oxygenated my muscles. I haven't done a little quick cardio first, and they said it's okay. It's just an assessment. We're not going to push it hard. But I got a full range of I got overstretched.
Yeah, and that's another huge factor, because when you actually work out the muscle and the ligaments, they actually begin to elongate somewhat. You have it's kind of like if you're pulling a car, and you're in one car and your car doesn't work, and I tow you. If I'm going along, and I'm towing you, and then I slow down, you start to catch up, and when I go again, it's boom, and there is an elasticity in the system that we have to get through, and that's really what stretching should be about, and warming up, particularly warming up, should do, is to get rid of that elasticity. Because if I'm holding something and all of a sudden that elasticity comes out, I mean, it could create an injury just by the fact that I didn't warm up.
Right.
Because I'm coming to the end of that elasticity, it's opening up, and boom, and it's a harsh stretch. And so all of those factors, and I would always have somebody warm up before I mess with the joint, because I want to eliminate that. In fact, my mentor for the structural correction side, his name's Burl Pettibon. He was in a car accident case, and he was on the witness stand, and they showed him a picture of a football player upside down. And as he was upside down, he said, "Wouldn't it be interesting for you to know that he fell on his head and got up and ran?" He goes, and he said, well, he got a chance to warm up and get rid of the elasticity in his ligaments and that. And he said, well, so what your patient should have done, what your client should have done, is should have, before he hit him from behind, should have got out of his car, rapped on the window and said, "Hey, could you warm up? I'm about to hit you," right? Because all of a sudden I'm doing that without decreasing that elasticity, which renders the impulse that much more difficult. And so gotta have a true warm up. And warm up doesn't just mean get blood to the area, though it does. It also means particularly get the elasticity out of those parts, components of the joint. And what are they? All the fiber that wraps the muscle, and when it's beyond the muscle, it's a tendon, right? And then it links into the bone. That's all susceptible. But also the joints themselves with the ligaments, all of those have to get rid of their elasticity, which means you have to go through full range and get that elasticity to come out so that it's as strong as it potentially could be.
Okay. So now how do we test where it's torn?
Okay. Well, we're going to look at it functionally. Go way back. We're going to look at it functionally, because I want to know the range of motion or the activity that's going to create that. Because we can say, well, okay, I've got muscles, and we can separate the activities of muscles, which really we can't do that well, and that even though it's in many books, right? So what we want to do is, what's the motion that you do that you feel this get worse?
Okay, if I come backwards down the stairs, or
Okay.
if I do anything where I'm bending, reaching into the grocery cart to get out stuff, I fell into the grocery cart. It just
Okay.
completely gave way. And also now I'm noticing that my left knee is starting to give way at random. I'll just be walking along and go, oh no.
Yeah.
I just know that that's instability in my
Yeah.
system.
And so is it pulling backwards? Is it going forward?
I'm falling out to the side.
Right. But I mean, where's the pain
Oh.
in the movement when you move that?
It is chink,
Yeah.
real strong
What is the activity?
when I'm doing the bend.
Okay, so when you're
If I'm-
bending,
yeah.
in what direction?
Yeah, I can walk okay, and I can seem to hold my walk without falling, but as soon as I do any kind of a motion where I reach out or I'm not exactly lined up perfect,
Yeah.
and then I have to go, you can't help it.
Yeah. So if you were to pull your knee straight up, does that increase the pain?
No,
Good. So that's not it.
that's not it.
Okay, so let's go over in a diagonal upward.
Okay.
There you go. Does that?
No.
Okay. Now we're going to go up and in, or up and out. Does
Yeah.
that?
Yeah, it
Okay.
makes it scared.
So now we're going to go, because there's an infinite number of possibilities here.
Right.
We know that is the direction. But we're going to start moving through the range. I'm going to pull, you're going to pull, but you're going to start to roll outward and see. We're going to see the actual angle. Okay, so pull up. Okay, and now start coming out, but still pulling. Okay, tell me when it's at the worst.
Right in there.
Okay, so that is the worst that you're feeling. And where are you feeling it?
All in the ball and kind of into the bottom of the hamstring, but mostly in the ball.
Okay, and so a rehab is going to actually be the opposite. The opposite is diagonally inward. Okay, so as you come in and down, go ahead. 4, 5, 6, 7, 8, 9, 10. Relax. Pull in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull in. 4, 5, 6, 7, 8, 9, 10. There we go. Now let's go out against resistance. How's that?
It's better. It's still.
Yeah, but it's still.
Yeah.
And so it is very apparent that from an orthopedic test point of view, that you have at least a sprain, maybe a sprain, in it, and that the rehab is basically the opposite of where we are experiencing it.
Okay, how often do I do is that the only rehab that I have to do? Is just this inside?
Well, we're going to of necessity ice to knock down the inflammation and we're going to do the rehab lightly for a little bit, and then we're going to find out can we actually put more and more pressure going in that opposite direction. Then we're going to start to seriously strengthen it.
Okay, well, I had to give up the dance class, so how long, what's the average heal time for a 60-year-old on this?
Well, the average heal time for a 60-year-old like me is probably 4 or 5 weeks.
Okay.
For you, though, it's probably 3 or 4 weeks.
Okay.
Because you're in much better condition.
Okay, and then with the dystonia, does the dystonia affect my joints? Because I know with the seizures I'm being pulled on all the time.
It affects everything. Particularly your kind of seizure is affecting your entire body.
Okay, so it made me a little prone to susceptible.
Yeah, and that could aggravate it.
Okay.
Yeah.
Okay.
Very
Thank
good.
you.
All right.
Thank you.